You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to part 2 of the Pharmacy Podcast Network's exclusive press and media coverage of the 2024 National Association of Chain Drug Stores Total Store Expo, held in Boston, Massachusetts from August 17th through the 19th, 2024. The NACDS Total Store Expo is a premier annual event that brings together industry professionals from across the chain drug store community to connect, collaborate, and grow their professional networks. This event is a hub for discovering new and innovative products, technologies, and services that are transforming the pharmacy and consumer goods industry. In this episode, we continue our deep dive into latest trends and insights from the expo floor with exclusive interviews and discussions featuring key industry leaders and innovators. And now, let's dive in with your host and the founder of the Pharmacy Podcast Network, Todd Eury.
Mark Asenza, this is the NACDS TSE 2024. So good to see you.
Great to see you too. Thank you for having me on your show.
Absolutely. So different vibe at the NACDS than what you and I attend other conferences. We just got done with the wonderful Idea Share experience. We were embedded in the IPC booth and really had a mix of some great interviews. This show seems to be this faster pace evaluation of items, products that is the innovative stuff. We were talking about bee pollen. We were talking about Enliven Health or outcomes. And so we're going to be talking with Ashton about Eye Care Plus and digital. But what I want you to share the listeners with is the vision for the rise of the micro chain. Michigan, there are now 0 Rite Aid stores in the state, and it's going to be an opportunity for independent pharmacies to really rise, the ones that are positioned well. Part of that positioning is being a member of a group like IPC to really get that infrastructure. Talk to us about the difference between the standalone onesie-twosie independent community pharmacy versus the support for these micro chains.
So I think what we're going to find going forward is if you can have at least similar offerings and be able to go to a community as a group such as an IPC where you have something like a digital health and something that is replicated and can be translated between independent pharmacies, and you can aggregate the knowledge, the scale, the operating expenses of all that and give the maximum value to the independent owner. What they're going to be able to do is take advantage of some of these opportunities with the chains pulling out, whether it's in lifestyle, helping with people in terms of their weight loss or smoking cessation or the different things that people will come in as a healthcare destination. And if we can start to provide those services, which we are, I think they'll be very much integrated into their community health and, again, help us prosper long into the future and be future ready.
So what about the clinical documentation and services that come along with some of the disease state management? What services and products are IPC staging for your members?
So, I think one of the innovations that are going to come about is, as of right now, we've launched our point-of-care testing, which is a take-home test for certain different diagnostics, depending on whether it is testosterone or A1C. The future in innovation is going to be point-of-care testing right at the site, and then being able to either integrate with a teledoc service, or at some point when pharmacists are going to be providers, have provider status and be able to write prescriptions, you'll be able to solve a lot of these afflictions that right at the pharmacy level, and not having to interject with another provider and just make the system more efficient. So what we're looking for is to arm our members to be able to practice at the top of their license, give them the diagnostics and the tools to be able to compete in the future. And as we get towards this healthcare destination and the ability to get more and more services at a community pharmacy, we'll be ready for it.
This is exciting to be a part of this show and the collaboration between the multiple associations, NACDS working better with NCPA, working better with APHA. The unification is greater than ever. And from what I remember 20 years in pharmacy, NACDS has taken a stand to really push for PBM reform. how has IPC worked with NACDS over the years in order to develop a strong relationship for the membership?
So I know you'll be talking to the government affairs person, Mark Kinney, on our team. What we try to do is we try to share resources when we're on Capitol Hill and also at the state level in order to be able to educate each other, educate lawmakers, educate pharmacists, and more importantly, get pharmacists involved in dealing with their local legislators, whether it's a federal or a state level, in order to tell the plight of not only what the PBMs are doing to community pharmacy, but what does this mean for healthcare delivery in the nation for underserved communities? And I think that NACDS, as well as the other groups and IPC work well together as to a common goal of we need to be fairly compensated, we need the networks involved, we need the infrastructure of independent pharmacies out in the world such that pandemics where 90% of COVID vaccines were done at retail, those are the types of health infrastructures that is for the safety of the nation and quite honestly for the benefit of the communities.
Mark, we love working with IPC and the team. Shout out to Matt and all of your marketing team. Great people. Appreciate you being part of the post show.
Yeah, and thank you for having me on my show. Thank you for what you do for independent pharmacy and being a voice to educate us all, as well as keep us well informed as to what's happening and bringing on innovative speakers and what's new in the zoo in order for us to take a look at what can we do in the future, and education and exposure for our members is the most important thing to know what's out there. So thank you for what you do.
Thank you, Mark.
Hi there, this is Mark Essence, CEO of Independent Pharmacy Cooperative, and you're listening to the Pharmacy Podcast at the NACDS Post Show.
Quick story. Okay, so I was researching supplements, and I was on Google, and someone, one of a pharmacist's friends, I can't remember which one, mentioned bee pollen. And so I'm like, all right, let me research this. And then I got a sample, and it was called Bee and You, and it had really nice packaging and gave me energy. I'm sitting down for lunch at the NACDS Total Store Expo 2024, and just start up a conversation, as I do. I like talking with strangers. I meet Dr. Ashley Shamanchi, the founder of Bee and You. Blew me away. I got to go over to her booth and see her family. It's a family-run operation. Her husband, which is a beekeeper. This is incredible. I want to welcome you to the NACDS TSE show.
Thank you, Todd. It's nice to meet you, and I feel so lucky.
I feel lucky. All right, so talk to me about, and our listeners, about the organization and what you've built, Bee and You, and how important, obviously, bees are to our ecosystem, but also the products that you have are so rich in nutrients and what they're doing for us. But give us an overview of Bee and You.
Of course. We are producing natural supplements and skincare out of natural bee products. Bee pollen, propolis, raw honey, royal jelly, also bee venom for the skincare part. We are the experts in this field. I'm a food scientist, master's degree. I have a doctorate degree in biology on developing skincare formulations with bee products. I'm an expert about bee products over 20 years, together with my husband. He is also agricultural engineer, master's degree, and a beekeeping expert. We are in the bee family, and bees helped save my son. Because he was having a highly serious autoimmune disease when he was 5 years old. And one of the doctors we visited, he told me, Aslı, why don't you give him propolis and royal jelly? You are within the beekeeping industry. You are together with beekeepers. Why don't you give him those very nice ingredients that will help his immune system? I said, where will I find the right one? Because most of the bee products, unfortunately, are adulterated in the world right now, we know. And I'm an expert about determining the authenticity of bee products. So when I analyze the products out there on the market, the real ingredients, bee ingredients, are not there. So I don't trust. He said, then why don't you produce for your son? So that's how I started producing propolis for the first time for my son. And it worked very well. It's a resin that bees collect from the trees, and it is the most strongest natural antioxidant, antibacterial, antiviral, antifungal in the world. but it's not edible in its raw form. It has to be extracted. So I extracted propolis for the first time for my son. It's now the 30% extract on the shelf where you can reach from my website or Amazon, and it helped his immunoglobulins go over 2 times. We started with 400 and it went over 800 in 6 months, and he was all okay. The autoimmune disease was gone, and his high body fever problem was gone, allergies was gone, and he is now 19 years old, and since then I believe that I pay a life to the bees. So I try to tell the world how crucial are they for the environment and also for the ecosystem and the human beings for their health. They are producing so strong substances. Some compounds in bee products, in propolis, in royal jelly, is not available in any other food in the world naturally. So you can only get them from there, but it has to be real, authentic, and propolis has to be extracted in the right manner. So if you are in good hands with B&U, believe that it will definitely work on your body as well.
Talk to me about application for like some of the disease state managements that are out there that pharmacists are starting to get more involved in. I'm thinking of diabetes or hypertension or even allergies to certain foods. So talk to me about, because some of the products that you have a B&U Kids shot and you have the propolis shot, the energy, of course, the nasal spray. Talk to us about some of the applications and how it can help people.
Well, the first product that I developed was propolis extract, and from this strong propolis extract, I started developing other products. For example, vitamin C shot together with vitamin D3, zinc, and propolis is a natural shot, and it's a combination of all these good ingredients. There are no additives, no sugar added, no caffeine. It's just a natural shot to support your immune system. You take 1 a day. It's enough for your vitamin needs, plus enough for your propolis need, and it works very well. We also have throat spray, nasal spray. The throat spray version is one of the best sellers on the market, and it's one of the strongest on the market. It really acts immediately on sore throat. It's also good for teeth and gums, and also good for relieving allergies as well. We also have a nasal spray which is tested clinically on 10,000 patients in 50 different locations to relieve allergic rhinitis. So this is now published and clinically proven. We have over 30 different publications with B&U extracts and products proving their health benefits. We have tested our 30% strong extract on type 2 diabetes. This was a clinical study run by 2 different universities in combination on rats, and it's not just helping the levels of sugar in the blood, it's balancing it. It's also balancing the liver enzymes at the same time. So 2 benefits come out when you use just one right propolis extract in your daily diet. It's never sugary. Propolis extract is a strong substance, and antioxidants are like onion. They have a strong taste. But you can drop it into your yogurt, into your smoothie, you can drop it into fruit juices. So you can take it however you want to take it. And I developed over 200 different formulations with different tastes. However you want to use in your life and in your diet, you can choose one of them. They are all produced with my strong extracts. I also tested during COVID time our propolis extracts on COVID-19. There are 4 publications right now in literature showing its antiviral effects against COVID viruses, 2 of them in vitro and 2 of them in vivo on humans. It is really very effective. And in one study, we studied with healthcare practitioners getting in touch with COVID patients every day. 200 people attended this study. 100 of them took our 30% extract, 40 drops daily into yogurt, and the other group didn't take any propolis. And after 1 month of trial, we saw that the group who was taking our propolis every day, they were 98% protected from getting the virus in their body. So propolis helps the body to get rid of pathogens, viruses, bacteria, and fungus as well. And we have proven this with this clinical study on humans. We have another study with cancer patients having radiotherapy and chemotherapy. Propolis also helps healing the cirrhosis in the mouth, scars in the mouth, and it also helps relieving if there is any problems in the mouth. It also helps relieving the body from side effects of chemotherapy and radiotherapy as well. Like, for example, they have less appetite. Cancer patients have less appetite. It also helps having more appetite during the therapy. And it also has, propolis itself, it also has anti-carcinogenic effects. So it's a combination you can take while you are having your therapy at the same time. It has no side effect. There is no problem while you are having it. There is thousands of papers showing on different cancer types: breast cancer, head and mouth cancer, throat cancer, cancers about pancreas, intestines, stomach. So different types of cancers. It has already been tested, and it's safe to use during your therapies, like a normal supplement in your daily diet. So we also have clinical studies about stomach ulcers. So you know that it's caused by a bacteria which is resistant to many antibiotics. But in this study, when a human take propolis, our extract, together with the antibiotics, the healing time is much faster. So it also helps, like a natural antibiotic, the therapy of such patients as well. So we have a lot of clinical studies already published. It's now over 30. And my company, I'm in this business more than 20 years, but my company is 11 years old. And we are not just producing the best quality products with our 5,000 beekeepers who look after 550,000 beehives.
That's a lot of beehives.
We are also extracting propolis with a patented technology. We are formulating them into natural products with our R&D team, consisting of pharmacists, pharmacologists, nutritionists, food scientists like me, and biologists. We have a huge team. We also prove their clinical effects on humans, not only for supplements, also for the skincare products that we send out to the market. And it's also very important that all these products must be produced in a very clean environment, free of pesticides, veterinary drugs, away from railroads, industrial areas, so that you don't end up with heavy metal residues or polyaromatic hydrocarbon residues in the products or pesticide residues in the products. This is also important. So they should be authentic, real, as it is from the hive, and they should be clean and free of any contamination as well. That's what we are doing. We are trying to serve as a servant between the bees and the humans, just bringing all the health from the hive to the humanity.
That's great. Are there any humans that are naturally allergic to propolis or bee substances?
Of course.
Okay.
As there are many people allergic to many different things, there may be people allergic to honey, allergic to propolis. So what we can do, if it's the first time you're using propolis in your life, you may start a very small amount into your skin.
Okay.
And 1 drop, let's say. If you don't see any allergies like redness and itching, you can go on adding drop by drop every day, using more and more. That's how you get used to meeting a new food. That's what we do when our children are newly born. Until 1 year old, we feed them with mother milk, but over 1 year we start with small amounts new food into their diet, and we increase the amount. That's how we do in our daily life as well. If you're taking a new food, take a very small amount and see the effect, and if it's okay, then you can move on.
Our listeners want more information. Where's the best place to go that they can get more information?
We have on our website, bnu.com, there's a direct chat option, so they can ask questions to our experts. And there's on our Instagram page, there's a DM option that somebody is always responding back, and they can always email us, and they can also follow me, as my Instagram is Propolis Experts. So they can ask me direct questions as well. So we will try to help as much as we can, and we can even send clinical studies, results, and publications to them about their the health benefits of propolis or their problems.
So I want our listeners check out beandyou.com. That's BEE and you.com. Dr. Acelia, this has been very special, and we're going to have you back on This Week in Pharmacy.
Thank you very much.
Thank you. I ran into Heather Haro from Diversify RX.
Yes, I am here. Hello.
I can't believe you're in Boston.
I was thinking like I need headphones, but
You do. We forgot them.
that's okay. That's
Well,
all right.
Why would a podcaster that is going to be ready to interview 30, 40 people forget the headphones?
You know what? It's the same reason why a 47-year-old cannot, and I mean cannot, keep her shoes tied.
See, I'm glad that we share some deficiency in our.
Yes. I haven't been in front of a mic or a video in a while, and we just did our summer webinar series on Diversify, and I remembered how dorky I am.
Oh, I love it. I love talking to you, the energy you give off. Knowing you since the PDS days, it's just come a long way. But the mystery for me when I heard you were coming, I was so excited that you're coming. Diversify RX being at NACDS, and the answer you gave me was really freaking cool, because you're looking out for this precious membership that has been built over the years, and you're looking for the best of the best. So I thought you were here kind of as, hey, maybe we can grow out some micro chain or do it, and that's not it. You're actually here to evaluate what's happening in the pharmacy sector from a retail perspective.
Absolutely. So I take off my looking for members, kind of sales, although we don't sell. That's kind of wrong to say anyways. But I'm not here to talk to pharmacists, I guess is a better way to say it, which is predominantly, not so much what I do. I don't get to speak with a lot of pharmacists in my role. I speak with a lot of partners and exhibitors and companies. And so I will say to you, just like I tell Lisa, NACDS is like my Super Bowl.
Yeah.
I love coming here. I love this show. I love seeing old friends, but there's always some new little nuances that I love to take back and share with the independent pharmacies. Last year, I got really excited about Claire's. Claire, like in the mall, get your ear pierced. So they've been working for a whole year, and they are going to try and help us get these very exclusive, cutesy, amazing, all of their little trinkets in seasonal boxes. Oh, okay. And they're going to develop a chain for independent pharmacies. Before, you could only buy through big distributors, and you had to be ginormous. And this is the second year now, they've heard me and they are working on it. And so I am thrilled about that one. But it's things like that I get to really dive deep a little into the background in some of these companies, where on the phone, and I think everybody understands this, pharmacy trade shows are so invaluable because you actually get to see somebody face to face, and you get to, shake a hand and maybe break bread and really have real in-depth conversations face to face. And that allows to learn more about where they're coming from and about where we're coming from. Because a lot of these companies here, honestly, they do require bigger distribution, which we can do, but man, we love when they can go direct to the independents and save them a few dollars while they're at it.
What products have been interesting to you this year? Have you seen, and I know this is the first day, but have you been able to get around and see anything new? Yeah,
so there is, you're tricking me here with this, but there's one company that has GLP supplements, and they have a step-by-step plan. One is hydration, 2 is protein, 3 is fiber, and these are packages that you can sell in your pharmacy. I absolutely love that idea, and I'm already speaking to them about coming to our show. But I just absolutely love that. I absolutely loved EOS. HIMPS is always fantastic to work with. I just love meeting with people that truly give a hoot about the independent pharmacist.
Yeah. All right, I have a question that as you're talking, and I'm thinking from my own perception of being at NACDS, I see things at NACDS that I never see at NCPA, or I never see at Diversifier X, for example,
right,
that are these kind of new ways of thinking. Now, the pharma companies show up, which is great, but it's these innovative, I say innovative products, but other people might say just for selling something. But putting education behind anything could differentiate it.
Yes.
Let me make an example. There are two, I'm going to say, women's health product distributors that are here. I can't remember. I think one's called Satisfier, and then the other one I can't remember. But they're sexual toy companies that are positioning themselves as health tools.
That's right.
But then they teach women, pharmacists, men about the science of it, versus it just being like, we could say, oh, it's just a vibrator store. No, these people are like dissecting the reasoning behind this. That is so fascinating to me.
All of those types of things are fascinating to me, and I think independent pharmacy is ripe for that. It's where you're having conversations. It's where you see Judy that comes in once a month for her prescriptions, or whatever the case is. You already have that trust within your customers.
Yep.
So introducing products that truly can help their lives, whether it be something as sex toys, and I met Satisfier last year at this show.
Yep.
But I think it's valuable. Also, in that same context, we talk about men's sexual health in this country like it's water now.
Right.
Nothing is taboo anymore, and I think maybe women's sexual health could kind of catch up to
Absolutely.
that. And I think that why not independent pharmacy?
Exactly. And make some money doing it.
Yeah, absolutely.
Like this is you guys have this down pat as Diversifier X, but if we had a teaching program that taught independent pharmacies how to best sell anything, and you put a program around it. And in this case, imagine in Pittsburgh, Pennsylvania, there's a seminar put out by a pharmacy owner that teaches women about their sexuality.
Yep, we do that. That's what we're already teaching, is strategies around not to just... So when I'm walking up and down these aisles, I'm not thinking that's cool, because there's a lot of really cool stuff.
Yeah.
But I'm really thinking how it connects to communities, how to sell it, what could be the strategy behind it. Is this in addition to a prescription, or is this a one-off thing? Is this something that they're going to grab at the register, or is it something that they're going to go in and look in the back of the store for? When I'm walking up and down these aisles, I'm sure that I have my ugly face on because I am thinking hard, but that's truly what I'm thinking is how does this best work in the independent space, as opposed to, man, that cream is really, really good. I mean, there's some facial stuff over there that I think is fantastic. I think it might just be the wrong spot. I mean, and who am I to say? I'll still, have my blog of all the fun things that I found. But, it's things like that I'm thinking. It's strategy. And then, of course, I take it back to Lisa, and Lisa always 10x whatever I'm thinking. I put 5 layers on it, and she can give you 3 more on just how fantastic it is or how you can use it.
Skin is a key, because a lot of people, me, for example, I'm horrible with my skin. I don't do anything consistent. If my wife has a new product and it's lotion, or it's usually expensive stuff, then I'll put it on because I'm curious. But then all of a sudden I forget to do it the next day. But the reason why I say that is skincare is a huge moneymaker for pharmacies. It is.
And I think... So the products, yes, but also the education of why. And that's why having, your social media to be able to showcase your expertise. I mean, pharmacists are so, and like, excuse the pun, but badass. Like they truly are. They are so knowledgeable and all-knowing and genuinely nice, caring folks that their ability to really change a community is there, and I wish that more knew that about themselves. I guess is a better way to say that.
Yeah, because unlike me, there are these hyper intelligent chemistry, biology, science background people that then went for their PharmD, got their PharmD. That is not necessarily, sometimes they can be, but they're not marketers per se, or they're not out there with the public relations, or they're not really thinking, how do I get my messaging out? Now, we do have some superstars out there. If you go out on Instagram or even TikTok, there's some really amazing, Phil Cowley is crazy, and
I
Phil's
totally,
my pharmacist.
I 100% agree with that, but I also think, so there are superstars, yes, but you could also be a superstar in your community. And you've heard me talk about this ad nauseum, but you can be the expert in your community.
Right.
It's having a podcast like, a small, hey, listen, that's how I started. I had a radio show selling in-home care. Yeah. And it was because I could not get the doctors to recommend me, so I had to figure out how to get to the people who were buying it. And at that time, it was boomers. And so I paid the money, my own money. I was not employed by the radio station, bought my own show. It was called Boomers and Beyond. And the sole purpose of that thing was to get folks to understand that I could help them with their aging parents.
That's brilliant.
And so it's the same thing. Pharmacists have the ability to do that. And you don't have to do a daily show. I had a daily show, but you don't have to do a daily show. You could do a weekly show.
Right.
And it's 20 minutes out of your day. Pre-plan it. Yep. So get all of your information together and do the show. Put yourself out there. Take all that awesome knowledge that you have and share it with the world, and it'll come back to you.
I've enjoyed this time with you. It's not enough. We're going to have to, after this recording, maybe go get something to drink or just chill out together. But Heather, thanks for being on the post show for the NACDS Total Store Expo.
Yeah, of course.
This story is sponsored by Novavax. As we prepare for the upcoming fall vaccination season, COVID-19 remains an important disease that can often be prevented through vaccination. During the 2023-2024 vaccination season, COVID-19 hospitalizations were higher than flu hospitalizations, yet COVID-19 vaccination rates lagged behind flu vaccination by more than 50%. Market research shows that consumers' willingness to get vaccinated increases when they are offered choices, and also when their HCP or pharmacist recommends them to get vaccinated. Your recommendations to patients are critical to help increase COVID-19 vaccination rates this season. It's important to have fact-based conversations with patients about what's best for them this upcoming vaccination season, and to convey that people who received one type of COVID-19 vaccine previously do not have to receive the same kind again. To learn more about Novavax's 2024-25 COVID-19 vaccine, visit Novavax.com.
In 2022, Pharmacy Podcast Network attended the National Association of Chain Drug Stores Total Store Expo in partnership with Babson Diagnostics, and we were embedded in their booth. We partnered with them. We did some interviews. We've been now partnering with them at the NACDS for 3 years in a row, and I'm here with Dr. Nick Turas, who is a previous Pittsburgher, right?
That is correct.
How are you, Nick?
I'm doing fantastic, Todd, and it's always a pleasure. And the partnership for the last 3 years has been amazing. So really, really appreciate your advocacy on behalf of Babson and our Better Way blood testing service, and just overall your enthusiasm that you bring to our profession of pharmacy. So really appreciate you, Todd. Thank you.
It's very sincere, because I was so excited when I first learned about you through Finn Partners, and they kind of gave me some preview, and then when I talked to you the first show that we were at together, you blew my mind, because I'm like, community pharmacy, people are accessing healthcare more through pharmacy than any other healthcare outlet, and now we're going to have blood testing ability inside these pharmacies, but having a coordinated effort from an organization that knows what's going on and controls all the labs and the data. And to have all the product picked up or the blood picked up at the end of the day. It blew my mind, but we've come a long way. You've come a long way. Babson got FDA approval just recently. Talk to our listeners about the updates.
Yeah, so our sample preparation device and hand warmer are FDA waived devices, but then we partnered with Becton Dickinson on the BD Mini Draw. Prior to it being called the BD Mini Draw, it was BD's next generation blood capillary collection device. So glad that it is now named BD Mini Draw now because it's such a mouthful. But they partnered with us because they wanted to find a way that was better than milking your finger for capillary collection, that was easier, produced a higher quality sample that you could get clinically equivalent results from. So in combination with the BD Mini Draw and the Babson ecosystem, we were able to produce that. We ran the 510K study and did all the different types of studies within that 510K study. BD was the one who took that with their next-gen blood capillary collection device to the FDA. It was approved. There's two different tubes, an H&H tube and an EDTA tube that were approved late November, early December of last year, which was awesome because then we were able to kind of validate our ecosystem and that blood collection with pharmacies, and once we were able to finish that up, we were able to launch recently in May with HEB in 5 stores and then another 5 independent pharmacies and community pharmacies, and then our own collection site at headquarters.
Was that Tarrytown Pharmacy?
No, it was People's Pharmacy, and then Lake Hills Pharmacies. So Nicola Trevis is the director of pharmacy at People's, and they have 4 locations. And then Lake Hills Pharmacy, who is Joby John, who was the president of the Texas Pharmacy Association.
Yeah, shout out to TPA.
Yeah, absolutely. TPA is phenomenal. Love TPA.
That's awesome. So talk to me about the show. The reason why I keep coming back is through the partnership with Babson, I realized how I was overlooking chain. In our podcasts, we really didn't have a lot of chain-specific discussions. This opened up our whole vision as to, wow, this is huge. And it's helping the independents that are positioned with multiple stores become micro chains based on some of the services and the partnerships that NACDS is helping chain drugstores to build. So talk to us about NACDS for Babson Diagnostics.
Yeah, I think one, NACDS, shout out to them, amazing job at Total Store Expo. They just bring so many innovators and so many companies that are willing to partner and strategize with you, and they bring so many different dynamic solutions to the pharmacies that help them differentiate. One of the things that Babson is trying to do, right? I think you see these community pharmacies, independent pharmacies, and these chain drugstores. We know the patients are going there. Recent studies show average of 35 times per year. But in healthcare, sometimes we're trying to force the patient to go to places they're not. For example, with blood testing, let's go to a patient service center that has horrible hours, aren't open on weekends, aren't open nights. So now patients have to take off of work to go there.
Right.
Yet my pharmacies are open 6, 7, 8 o'clock at night, have hours on the weekend. Mm-hmm. They're there for all their patients' healthcare needs.
Right.
And here now we're taking blood testing the better way to patients at convenient, accessible locations, at locations that have better hours, that I don't have to take a half a day off of work to go get a blood draw or blood test, and also in a less invasive manner. So I think the most important thing that pharmacies have to offer is it's where the patients want to be.
Yep.
And events like this, NACDS Total Store Expo, really highlights all the different opportunities that pharmacies have and touch points with patients to provide their healthcare needs, or needs that they may not even realize they have. Mm-hmm. So NACDS is always a super exciting event to see the innovation and the collaboration between not just pharmacies, but the partners that are here. One of the coolest things I experience at NACDS is just all the different vendors that are here with their different solutions, coming by the booth, wanting to find out what we're doing, seeing if there's synergies that could help us, asking us if we thought about this or that. It's just so enjoyable to see so many people committed to healthcare and trying to make it better in this country. So, you know, I can't thank NACDS enough for putting on this event and bringing people like this together.
Yeah, I agree. So another thing that fascinated me about Babson Diagnostics, and as you as a pharmacist were really able to elaborate this, is the data that you're now extracting from, of course, the test and relaying back to the pharmacist, relaying back to the physician. That data, that's important, and especially if you have some kind of condition that you have to keep doing testing. That accessibility, there's another layer of trust that's built in, since people trust their pharmacists so much anyway. Talk to us about that data.
Yeah, and I'll even back it up away from the data a little bit. I think one of the most important things is just getting people to get tested.
True. Yeah,
right? Like, I have to get you to get tested in order to get that data, or I'll call it knowing your numbers, in your hands, so you can take actions on your health. And you know, at Babson with our Better Way method, we just recently launched. We did kind of a soft launch with those 11 stores, and what we've seen in traditional methods of blood testing is about 40% of blood tests that are written for never end up being filled.
Jeez.
For various reasons. So 40% of the people don't get that data. They don't know their numbers. Their doctors can't diagnose their conditions off that, which is really concerning.
Yeah.
In our soft launch over 3 months, we have over an 80% adherence rate. So 80% of those tests that are getting written are being fulfilled at Better Way. So if we can change that adherence rate, one, I can get more information into people's hands, and then actions can be taken from that, whether that's a diagnosis from a doctor, whether that's a lifestyle modification from a diabetic patient with a A1C, or maybe they actually become adherent to their medication because they realize their A1C's out of whack and that medication's working, or a pharmacist could use that to prove that their medication is working, and they need to keep taking it, and they need to stay on that path so they can have healthier outcomes. And the way that we do the data at Babson, I'm really proud of our reports that go out to Better Way. It's accessible from the patient's phone. You can log into your account from your phone, so you have it right there. I mean, how many people, have their phones with them at the doctor's office, have their phones with them at the pharmacy? I mean, if I didn't have my phone, I couldn't tell you where I'm supposed to be in the next 5 minutes, Todd. I'd be lost without that device. We've become so dependent on it, whether that's communications from text, email, our calendars, our schedules, our phones. But the way it comes back to that patient is in a very simple way to understand. It's color-coded, green, yellow, red. Red meaning you're probably way out of range and we need to hone you back in. Yellow saying this is something you want to watch over some time. And green saying, hey, you're in a good area. And then under each assay, under each test, it's going to explain what that test is, why you test it. And then if you still want more information, we have links to help you understand even more. If you want to dig deeper than the overview we give of, what liver function enzymes and why they're being tested. So we really want to try to help educate the patient so they can be involved in their healthcare decision making.
So I experienced the test myself. I put my hand on the warmer, which was a brand new experience for me. I had never had my hand warmed before giving blood. For some reason, it made me relax more. Plus, the blood seemed to come faster because it was, warm instead of because my hands are cold all the time, and especially in these conference halls with all the air conditioning. And then the clamp that was put onto my finger, and then they're like, "You ready? 1, 2, 3." A little bit of a prick, it was the easiest blood that I'd ever given in my life of remembering to give, in giving blood. I probably don't do it enough. What feedback are you getting from patients about the experience?
Oh, man. So we actually started a Net Promoter Score, which has been very, very awesome to see, and the feedback that we've gotten from this Net Promoter Score. Our Net Promoter Score is an 82, and over 80 is elite. So super excited about patients trying it, liking it, recommending it. But then we also give them an opportunity to give us some feedback with that Net Promoter Score. We've had the gamut of, oh my God, the UI UX experience is amazing, your report's awesome, super easy, to I have medical anxiety, I can't get into my physician, I was worried about my lab values, I didn't realize that I could self-order this without my physician. I was able to go to my local pharmacy, schedule an appointment, and I had my results same day. So right now in our soft launch, our turnaround time for results is 13.2 hours. So 76% of our results end up getting reported back the same day.
That's incredible.
We will never let it go past 48 hours, but we've been able to turn around pretty quickly for patients, and patients are loving that. Patients are telling us all about it. We had another patient. So recently, we had a Wall Street Journal article come out.
I know.
Which
they
was
talked about Theranos,
super exciting, and that we're able to do it. So it was one. I've been at Babson 3 years, and seeing an article in the Wall Street Journal was really, really awesome. But in that article, one of our doctors, who's an endocrinologist, ordered the blood test for the patient, and this woman, 47-year-old woman, has lived her entire life with type 1 diabetes. So as you can imagine, she's getting poked and prodded, in the fingertip from being able to get her glucose and read her sugar, to getting A1Cs done every 3 months. She has some vein access issues, and she can't stand every 3 months going to get her blood collected because they poke her 3, 4, 5 times, elbow bruises. This doesn't look appealing. Right. The arm's sore. So this endocrinologist told her about Better Way, and she went to the local pharmacy, got her blood drawn, and said, "I will never go back to the conventional method as long as you guys have the test that I need ever again." She is like, it was easy, it was convenient, I was in and out in 15 minutes. The pharmacy staff was so friendly and so caring. She was like, just the overall experience, it changed for me. Like, that's cool. Now I don't have to sit there for an hour. I don't have them to poke around and try to find a vein for a half hour, 45 minutes. Like, to me, that's what this is all about, right? Giving patients a better experience, meeting patients where they're at on their healthcare journey, which, quite frankly, is the pharmacy. And having them be able to react that way, and just warms my heart, because here's a patient that was looking for an alternative and in 70 years never had one, and now they have one. Like, to me, that's what it's all about, and just being there for patients. It doesn't have to be a replacement either, right? This can be an alternative for those that want it. So just excited to be able to offer that alternative for patients. All right, the listeners listening, they want more information. What's the best way to reach out to Babson? So they can go to babsondx.com, or they can go to betterway.com as well and reach out to us. Or for any of our listeners, Nicholas.Turos, that's Turos, at babsondx.com. Feel free to reach out to me. I've been, it's pretty much the end of the show right now, Todd. This is the first chance I've actually had to sit down and talk with you and visit you. It's been a busy show. As you know and can tell the listeners, I love talking about Babson. I love talking about our Better Way blood testing service. Please feel free to reach out to me directly, or you can reach me through babsondx.com. And if you're in Austin, Texas, we're starting our full launch now. Feel free to look us up on betterway.com. and go ahead and order yourself a test and stop into one of our independent pharmacies or one of our select HEB locations and try Better Way out for yourself.
That's awesome. Thank you, Nick. Thanks for being part of the show.
Appreciate you, Todd. It's always a pleasure, my friend.
Hey, we are in Boston at the NACDS Total Store Expo, and I ran into my friend Habil with Sans RX LLC, but it's really Transfer RX. We were talking about the mothership. Transfer RX is an important organization for the evolution of independent community pharmacy. Welcome to the show, Nabil. How are you?
Thank you. It's great to see you, Todd.
It's nice to see you.
I think the last time I saw you, maybe 6 months ago at
It's always a conference, isn't it?
Yeah.
All right, so you have a special update to share with our listeners about Transfer RX. I want you to share that.
Yeah, Transfer My RX. We just launched it about a year ago, and there was some issue with the market at adopting the new technology, which, just to give a background, Transfer My RX is a technology that facilitates the transfer of prescription electronically between unaffiliated pharmacies. So now we do it manually. The best case scenario, we get the pharmacist's name over the phone, and then we fax the other elements of a prescription. But we got to an era, an age that nobody has time for that, and the patient is the one that suffers because they are having to wait 2-3 days to get their prescription transferred or hear back from that it's been done. So this is the whole idea, is to create more a newer technology and streamline the process and better workflow. There was not a legal issue, rather the standards issue. NCPDP is the organization that set the standards for this industry.
Yep.
And the last standards that they have named was in 2017. They named it in 2020, but that standards does not include that functionality, does not include that technology. The newer one, 2023, was. And that's the newer standards. Luckily, CMS named that as the new standards of the industry in July.
Yep.
So now we're seeing a lot more adoption of the technology, more acceptance. Independents, they love the idea, but independents are reliant on their software company who they use. They need their software to kind of get engaged and adopt that new technology, because independent might love the idea, but you don't control what your software is integrated with or not.
Yep.
So
describe to the listeners, just in case they haven't followed what you've invented and how it works with their existing pharmacy management system. Talk to us about how your system works.
It's the way we envision transferring prescription in the future. It should become like e-prescribing, where basically, based on patient request, it's pushed with push a button. It's sent from one system to the other system. Both are trusted systems through a secure channel, just like e-prescribing. The way it comes from e-prescription comes from a doctor system to a pharmacy system. Unfortunately, the federal law and DEA, FDA, and the state regulations forbid that, because it requires the prescription to be transferred, to be communicated between two pharmacists.
Okay.
That communication's always been done by phone. Then we decided, a lot of boards of pharmacies said, well, a fax is still acceptable.
Yep.
And now we're just basically moving into doing it electronically. Yet, still, it needs to be communicated. It cannot just be forwarded from one pharmacy to the other, because the law specifically, up till today, it says must be communicated.
Okay.
So even that communication must happen between two pharmacists. It could be done through computers talking to each other, but still, pharmacists on each side will have to still take one action, whether accept, reject, review, just so that it still is considered a communication between two pharmacists to meet the law.
So have you moved forward then with multiple PMS systems, pharmacy management systems? Are you full power now, or what stage of growth are you guys at?
We are integrating currently. We integrated with two pharmacy softwares, and we're in the process of integrating with one major chain and another software that serves the long-term care facilities.
Okay.
And the reason why, the reason that everybody was reluctant to move forward, and now we're seeing in the last 2 months a lot more acceptance and people wanting to move forward, is because without CMS naming the new standards of NCPDP, a Medicare prescription that could have been transferred through the system could have been considered illegal or held the payment because it was not according to the current standards.
Okay.
So that CMS did the industry a big favor by moving forward in naming the new standards, because that gave the whole industry allowance. Hey, now it could be done according to the NCPDB standards and according to CMS, which is the biggest payer in the nation.
Share with our listeners how they can learn more about your organization. Where should they go?
We have a website. It's www.transfermyrx.com. I oversee everything. My name is Nabil Halak, and although I'm the CEO, the co-founder, the engineer behind it, but I'm hands-on. I follow up on every single message, information. We have on the website information functionality, and I will contact that person. Even it could be somebody just inquiring, somebody just want to know more, somebody who has multi-stores, one store. We don't say no to anybody. We want to be more a resource of information, because we all need to work together to bring this on. I know that I don't want to take too much time, but let me just say one thing, and I always say it. I said, we always, almost on a weekly, monthly basis, almost a lot of us are using some kind of app to book a flight or to book a hotel somewhere. We hardly ever need to go to a bank branch. We can move money around, laying on the couch. And we're talking about two industries. One of them is finance, and one of them is aviation. We cannot be more regulated than those two. And yet they're moving. They're like years ahead of us in technology. So it's not making sense to us that we are so behind. We're still doing manual fax, phones, voicemails, and other industries who are regulated as well, they're ahead of us.
And it's slowing down patient care, so that's a big deal. Nabil, this is always good to catch up with you.
It's amazing.
Appreciate you being on the show.
Appreciate you.
Thank you.
Todd, as usual.
See you.
Thank you.
Fellow podcaster, part of the Pharmacy Podcast Network, Breck Rice with ServeRx. Breck, it's so good to see you here in Boston.
Hey, it's great to be here, Todd. It's always good to see you in person. We talk a lot remotely, but now being face-to-face is always great.
Absolutely. We really appreciate the insights and the organization of your participation in PBM Reform Podcast. That's an important station for us. We really use that to try to get the latest updates, not only from a national perspective, but also state to state. You're so good at really understanding the depth with how long you've really cared about community pharmacy. And just like me, if community pharmacy doesn't survive, then you and I don't have jobs. We're going to have to go be a mail carrier or something like that.
So true, right? Yeah, I mean, we've been at this a long time, you and I. We've been around community pharmacy. I mean, I started back in 2003 and absolutely love the industry. So it's heartbreaking when we see them struggling so badly. And I think just in my own network of pharmacies that we partner with to try to help get, fair reimbursements, we've probably seen 3,000 closures over the last year or so, and it's just really heartbreaking.
It is. What I'm proud of is the National Association of Chain Drugstores, NACDS, is very much involved in PBM reform, very pro PBM reform, because it's impacting their membership. It's impacting their grocery store pharmacies, their micro chains. Let's talk about independent pharmacies specifically, because they are the future of the micro chains. We're seeing a lot of pharmacies that have the depth start buying up or helping to provide services to other independents, and they're becoming little chains, which is kind of cool. But what I want you to share with our listeners, how does ServeRx help the independent community pharmacy or even the micro chain?
Yeah, no, I appreciate that. I always love talking about my own company. So co-founder there of ServeRx, it's the new and improved third-party payer for community pharmacy. So the grandfather of the industry, was acquired by one of the big pharmacy benefit managers, the PBMs, rolled into their managed care networks, which took all of the fair reimbursements out of it. And so when I had the opportunity to co-found ServeRx, we had independent pharmacy in mind. How do we take care of these partners to make sure that they were getting treated fairly? And so that's exactly what we do. We realize that we represent a very small percentage of their overall claims volume, but it's a very important percentage and a very profitable percentage when it's done correctly. So as now today being the largest third-party payer for community pharmacy in the country, we literally can get those reimbursements up to where they should be, at about the 60, 70, the $90 reimbursements rather than the $4 reimbursements they're getting from the PBMs.
All right, so we're going to preface this, but we're excited about talking with IPPN, but you brought us, independent, or you brought the Pharmacy Podcast Network, an introduction to IPPN, and it's really special because they are building programs that aren't necessarily based on a prescription, so we're not worrying about even the PBM being involved. But we know that clinical pharmacy, extension of care programs, going down into a disease state and becoming a disease state manager from a pharmacist perspective, that's happening. So talk to us, tell our listeners a little preview about our discussion that we're going to be having with Russ.
Yeah, absolutely exciting opportunity, right? And completely separate from ServeRx. We don't get any kind of kickback or anything like that from IPPN. We just invited them to be a part of our booth and our show here at the Total Store Expo, because more community pharmacies need to see this opportunity. And so part of my initiative to try to save the industry, right? Yeah. So every little thing I can do, whether it's hosting a podcast with you, right, talking about PBM reform, or providing, the fair reimbursements that we can do at ServeRx. I've been looking at the clinical opportunities for pharmacy because, again, it's another way that community pharmacy can bypass the unfair reimbursements of PBMs, and it isn't subject to DIR fees, right? Is doing more things on the clinical side. And there's so many wonderful programs out there. You've got Outcomes, and you got CPESN, all these programs that are helping pharmacies really, live up to the highest of their degrees, but they all kind of take it to a certain point and then stop. IPPN breaks through that ceiling. It breaks through that reimbursement barriers, and it's a turnkey solution that helps community pharmacies get into medical billing. Everybody's trying to do it, but what's the right, proper way? And it's also discussion around credentialing, right? Well, our pharmacists are credentialed. They're doctors.
Yep.
It's not that they need to be credentialed. They need contracting help. They need to be able to contract with those medical payers, and that's the other secret sauce that the IPPN folks. IPPN stands for Independent Pharmacy Provider Network. So that's one of their secret sauces, is being able to get those contracts in place on the payer side. So they're doing a wonderful job, turnkey, like I said.
Breck, we really appreciate you being part of our post-show. Are very thankful that you're part of the network, and we can't wait to hear your next podcast.
Hey, thanks, Todd. It's always great to see you.
Thank you.